Drug and alcohol abuse. So actually this abuse is very serious concern in many countries. So it is a very serious concern. So including India also. Including India as well as in many countries. It has reached the epidemic stage. So mostly affected people are adolescents and youth. So because lack of proper education, guidance, so they leads to more drug and alcohol abuse. So the youth especially has to protect against themselves, against these harmful drugs. And long lasting behavioral changes, they leads to physical, mental, social harm. So they are affecting their health. So physical, mental, as well as social harm. So, drug abuse is none other than the self administration of drugs. So, let's see the clear definition about this. Drug abuse is the self administration of a drug for non medical purposes in the frequencies for non medical purposes in the frequencies or quantities that impair the physical, psychological, and physiological functions. That impairs physical, physiological, and psychological impairment. Usually, there are several plants, fruits, seeds that have hallucinogenic properties. Mainly, they will select the plants such as hallucinogenic properties. So they will select the plants, seeds, as well as fruits which is having hallucinogenic properties. This is used for hundreds of years in folk medicine. In religious ceremonies and rituals. During this, use it for medicinal purposes. So drugs which are used for medicinal purposes also for pain relief. And mainly to cure mental health. For curing mental health. Insomnia. So the drug categories mainly belong to painkillers, sedatives, narcotics, hallucinogens, stimulants, So these are very often used for abusing. So abusing drugs will include, so mainly the medicinal drugs are painkillers, sedatives, narcotics, hallucinogens, as well as stimulants. And drugs are, coming to the list of drugs, we have opioids, cannabinoids, cocaine, barbiturates, LSD, amphetamine, benzodiazepines, tobacco, alcohol. So just remember the mnemonic: A, B, C. Certain drugs when we can cover. So A for amphetamine, A for alcohol, B for barbiturates, C for cannabinoids and cocaine. So remaining we have to remember. So remaining are opioids, and we have the LSD, tobacco, all these things. So amphetamine, alcohol, benzodiazepines, barbiturates, cannabinoids, cocaine. So these are the drugs that is being used. The very first category we are going to see is opioids. So very first one is opioid. So what is this opioid? Drug which bind to specific opioid receptors. Present in CNS, central nervous system, and GIT. They include mainly alkaloid in nature. They are actually alkaloid in nature. Semi-synthetic and synthetic also you will be finding: natural, semi-synthetic, as well as synthetic. So let's see some of the important examples for opioids is morphine, codeine. These two are natural. Morphine and codeine is natural. And we have the heroin. Heroin is semi-synthetic. And we have the synthetic variety also. Methadone and pethidine, synthetic. You just remember morphine, codeine are natural, and heroin will comes under semi-synthetic variety. Coming to morphine and codeine, these are natural alkaloids. These are actually extracted from the latex of poppy plant. Latex of poppy plant. And these are actually the plant called Papaver somniferum. The plant we call it as Papaver somniferum. And morphine is very effective in sedative as well as painkiller. It is very effective. It was earlierly used for painkiller for soldiers mainly. Because of its addictive in nature, nowadays it is restricted to only patients suffering from tertiary cancers or amputation surgeries. So heroin is commonly called smack. Is commonly called smack. It is chemically called diacetyl morphine. It is semi-synthetic in nature. So produced by acetylation of morphine. It is white, odorless. Bitter crystalline. So it is adulterated form which we call it as brown sugar. So it is adulterated to form brown sugar. And heroin is administration slow down the body functions. It is considered as a class of depressants. Heroin is a depressant. Opioid is taken by snorting or through injection. So pharmacologically, they are the narcotic analgesics and the depressants. They are the narcotics. So they induce relaxation, reduced activity of CNS. Reduced CNS activity, reduce pain, anxiety, tension, lethargy, appetite, and it leads to constipation, loss of appetite, constipation. When it taken in excess, it leads to fatal depression. Mainly, so in excess leads to fatal depression. And it leads to strong addiction. And physical dependency. And the withdrawal symptoms are very severe. And the person will be having aches, tremors, sweating, diarrhea, cramps, convulsions, running nose. Stomach cramps, convulsions, running nose. So I'll tell you one easy mnemonic regarding this. Remember the mnemonic MCA. Morphine, codeine. These are alkaloids. And or else you can remember like MCH, morphine, codeine, heroin. You can also call it as smack. And these are depressants. MCH, smack, brown sugar. Heroin is particularly called as brown sugar, and these are depressants. This is the previous question they used to ask regarding this opioids.